Every February 4th is World Cancer Day. Cancer is a large group of diseases that can start in almost any organ or tissue of the body when abnormal cells grow uncontrollably, go beyond their boundaries, and invade other parts of the body. It is the second leading cause of death globally, accounting for approximately 9.6 million deaths, or 1 in 6 deaths in 2018. The most common types of cancer in men are lung, prostate, colorectal, stomach, and liver cancers, while among women is the breast, lung, cervical, and thyroid cancer. World Cancer Day this year is focusing on the value of individualized, patient-centered care, and it's having the theme United by Unique. Joining us to discuss today on World Cancer Day is consultant radiation and clinical oncologist, as well as the head of the brachytherapy unit at the NSIA-LUTH Cancer Centre, Dr. Bolanle Adegboyega. Dr. Adegboyega, thank you for joining us on Network Africa.
Yeah, good afternoon. Thank you for having me.
Thank you so much. Well, I want to begin by asking why cancer why do we still have cancer as a problem today in this 21st century? Many would think, by now there probably would have been a cure.
Okay, thank you for the question. So the good thing is that cancer as a problem is not unique to only Nigeria. It's a global problem that we're trying to tackle, and a lot of work is ongoing. The fact remains that cancer actually multiplies and divides, and a whole lot of changes do happen within the cell. So as you think you have gotten hold of one, other things keep evolving, then the change in the lifestyle, change in environmental factors, and a whole lot of work is being done to get the bit of that. There's so many success stories now. There are vaccines, and then we're now getting to individualized treatments where we're also using the immune therapy, the immune cells to actually fight the cancer. Hopefully, with all hands on deck, we should be getting to the end of it, hopefully.
Well, tell us a bit more about the theme, United by Unique. The focus is on the value of individualized, patient-centered care. Is cancer treatment, not already patient-centered? What more is being brought to care?
Thank you. There's a whole lot more to be done. So looking at a person involved that is being treated for cancer is a total being that has spirit, has soul, and body. So we're trying to say that we have to move forward away from only talking about the body. We have to consider the spirit of the person and the soul of the person. And the person that you are treating for cancer has a whole lot of people connected and related to it. And when the person is being treated, the work is at stake, the family is at stake, the caregiver has the work at stake, and the family at stake. So a whole lot. So, and then most of the treatments we are using so far, as studies have been done in developed nations are being given to Africa, but studies have shown that our makeup is a bit different from them. So people are moving, even in developed nations, they are moving to individualized treatment because that is where the cure to cancer actually lies. So we're talking about it being unique. Everybody has their own expert. So in treating cancer, we have the doctor, we have the nurses, we have the palliative caregiver, we have the psychologist, we have the family members and the caregivers. So we have the policymakers, we have the advocates. So everybody has to come together with our own unique parts of it and come together to be able to achieve a success story.
Speaking of other climes, we hear of people living with cancer rather than dying of it. What more can be done to make cancer less scary here in Nigeria?
So the major one for us in Nigeria is for early presentation. When people present early, then cure is still possible. But unfortunately, majority of our patients present at a time where you cannot do anything other than to palliate and to manage them. So in developed nations, they have been able to come to people getting screened. You don't wait till you have the presentation, you have the symptoms before you go to the hospital. You actually get screened, and so it's detected early, and then cure is actually possible. And other factors for them is that they have access to state-of-the-art equipment. They have a lot of clinical trials and what's going on in cancer. Finances is also there because there are other health insurance. So all these things are not possible, are still not possible in Nigeria. So until we move to when people actually get screened, we detect early, when we have cancer centers as close to patient as possible, when we have health insurance to actually take care of the treatment when it's detected early, and then when we have past these myths and misconceptions about cancer, then that is when we can actually get to where the rest of the world are.
And is there anything, the people who are not medical personnel, is there anything they can do to help live up to the theme of this year in helping, cancer patients?
Well, there's a whole lot. Like I said, treating cancer involves a whole community. So one of it is for people to be aware. Let people have the right information out there. Then cancer patients should not be stigmatized. It's not a contagious disease. So when you have, because of the stigma, people are not able to come out to declare their status. Health policies, work policies should be to support cancer patients. Health insurance should be out there. Then advocate, we are looking for NGOs and people to support people financially. Like I said, caregiver, you may also be able to assist a cancer patient by helping them even coming to the hospital or accessing care. So there's a whole lot that can be done. So they should also advocate to the government and to the people of the community. Vaccines is out there. People are rejecting it. Cervical cancer, vaccine is out. HPV vaccine is out there. People are rejecting. So the right information is also there. You don't have to be an healthcare worker for you to know that these vaccines are safe. It's been used and proven in the developed nation. It has not wiped out away their generation. So why will it do that for us? And these are things that can be done to prevent cancer so that we even reduce our incidence and of course reduce our mortality.
All right then, thank you so much, Dr. Bolanle Adegboyega, consultant radiation and clinical oncologist. Thank you for making your time on Network Africa.
Thank you.